Welcome, everybody. Thank you so much for being here. My name is Syed Ijaz. I am the State Advocacy Manager for the Every Life Foundation for Rare Diseases. As you all know, we're hosting a State Advocacy Day in Lansing, Michigan on September 30th. Thank you so much for being part of the program. Closed captioning is available for this webinar. Feel free to use Zoom's functionality for accessibility and closed captioning. Before we begin, a big thank you to our 2025 RDLA state advocacy sponsors. Without them, we would not be able to put on this event. A quick agenda for today. So we'll do, this intro. We'll provide an overview of logistics for the event. Then we'll shift over to our guest speakers to talk about the legislative asks for the event. We won't cover all of them today, but we'll give you a good deep dive on two of the three, and we'll save the last one for the day of. We'll have an open Q&A segment for folks to ask the panelists some questions that they may have about um, the legislative asks or ask me about the event itself. I'll give a brief presentation on how to advocate with your legislator and how to do the meetings. And then we'll do breakout sessions where folks will share their story. There's a lot of stuff to cover today. Don't feel pressured to write any notes because we'll be sending you a recording of the webinar later this week, along with a packet with more information. So the day of Michigan Rare Disease State Advocacy Day. It'll be on Tuesday, September 30th from 9 a.m. to 5 p.m. The dress code for this event is business casual. It's a day for all of us to come together and talk about important rare disease issues with our state legislators. For the event, we have 3 legislative asks, but you're encouraged to bring more into the room with you in your conversations with legislators. What can you expect? So the event will be in 2 phases. The first half will be a legislative conference from 9 a.m. to 12 p.m. This will be in person. We will be gathered and we'll go through a deep dive on the logistics of the event again, and all of the legislative asks, hear from some guest speakers, and be prepared for our meetings in the second half of the event. From 1 to 5 p.m., folks will break out into groups and meet with their state legislators to discuss a variety of rare disease issues and push these asks. All meetings for this event will be scheduled ahead of time through our scheduling vendor, Advocacy Associates. So the team that's going to be there on the policy and advocacy side from RDLA and from Every Life is Jamie Sullivan, our Vice President of Policy, Catherine Poe, our State Policy Manager, and then myself. But I should also note that we are partnering with the Michigan Rare Coalition for this event, and they're going to be a big part of this event. You're going to hear from them later today and at the event, but without them, we would not be able to do this event either. If you're no longer able to attend, please reach out to me at sejaz@everylifefoundation.org. It's important to let us know if you're not able to attend so we can remove you from the meetings that we've got you scheduled for. So if that ever happens, even if it's the day of the event, feel free to send me a note. If you are feeling sick or have symptoms of COVID-19, feel free to take a step back from the event. No harm done, and I'll be able to remove you from the meetings. I encourage folks to mask up if they'd like to mask up and do what they need to do to feel safe. When you arrive at our event, there will be multiple colored name tags or lanyards for your name tags that you can use to sort of indicate your social distancing comfort level. We still use these even now and today, just because it does give folks a feeling of safety and they can set boundaries as they'd like. But masks are optional. I encourage folks to wear them if they'd like to. So the schedule for the day. We are going to begin check-in at 8:30 a.m. And breakfast will be provided. From 9 to 9:30, we'll have welcome and opening remarks from a variety of speakers, including Leslie from the Michigan Rare Coalition. We'll have Grace Myers, who's one of our young adult rare representatives. and you'll hear from Every Life as well. I'll provide an overview of logistics once more, and then we'll have a presentation from our Vice President of Policy about Medicaid. Obviously, the cuts to Medicaid have implications for the rare disease community, and Every Life has been taking a strong look at this at the federal and state levels. Our Vice President of Policy will prepare our advocacy audience on what's going on with Medicaid and how to discuss it if you'd like to bring it up in your meeting. Then we'll go into the first ask, which will be an overview of the Interstate Medical Licensure Compact legislation and what that means for Michigan and why we're supporting this. Then we'll have a short break. Then we'll go into Legislative Ask 2, which is mandatory seizure training in schools. For this, we'll be joined by the staff of Senator John Cherry, who's the lead sponsor of the bill. And then the next ask is right after that, and we'll be talking about the Rare Disease Advisory Council legislation. Afterwards, I'll have another session on how to do the advocacy, how to do the meetings. And then we'll have another breakout session in person with the groups that you'll have for the rest of the day to practice sharing your stories, get to know each other, and coordinate for the rest of the day. After that, we'll have final remarks and adjournment. We'll take a group picture and we'll have lunch. And then meetings will begin at 1 o'clock. Some folks will be assigned meetings during the 12 to 1 period. And for those folks, I'm happy to let them have lunch earlier and depart early so that they can get over and begin talking to legislators. Parking and logistics. So public parking is available through parking ramps. Parking at each ramp costs $3 per hour and caps at $15 per day. There are multiple parking ramps around the Capitol, and I have listed their addresses here. There's also street level accessible parking at 231 South Capitol Avenue. Street parking is available for $75 to $1.50 per hour on Walnut and Washtenaw streets. And for more information, I have a link to the Michigan Capitol's visitors page, where you can look up more information regarding parking accessibility. But I'm going to have a deeper dive in just a sec. So this is the map of the Capitol, but kind of the northeast sort of quadrant encompassing the Capitol to show where the parking ramps are located and how long of a walk it is in order to access the building. The North Capitol ramp is a 7-minute walk, the North Grand ramp is a 6-minute walk, and the South Grand ramp is a 5-minute walk. Similarly, on the southwestern quadrant, you can access the 231 Capitol Ave parking lot, which is a close walk to the Capitol, 3 minutes, and then also the South Capitol ramp, which is a 7-minute walk. And then street parking on those two streets that I mentioned that you can park for up to 10 hours per day. It's those pink lines towards the bottom left-hand side. And again, I'll be sending all this information over, so no need to be writing any of this down. Entering the Capitol for the event. So the Capitol has an accessible entry through the Heritage Hall's Visitor Center, located on 323 Ottawa Street. I highly recommend this is the entrance that you use for the event because the legislative conference is happening in Heritage Hall. Check-in begins at 8:30 a.m. in the South State Room inside Heritage Hall. That is where we'll be having our legislative conference, and that room will actually be available to us all the way until 4 p.m. in case anybody needs breaks or a place to hang out, a place to get away. But that is our central location for the event. 323 Ottawa Street is where you want to enter. It is wheelchair accessible. And the state capitol actually has done a really good job making all their entrances accessible, but that is the entrance that I would use for this event. Travel reimbursement checks for those that applied and qualified for travel reimbursements. They'll receive their check during check-in. If you have any questions about travel reimbursements, feel free to reach out to me. And then please remember to grab your name tag, lanyard, and then we'll have some goodies for you as well for the event. Feel free to grab those and grab breakfast and find your seats. The conference will begin at 9 a.m. sharp. Meetings, the second half of the day, they'll be in the House and Senate buildings. There's the Anderson House Office Building, which is on 124 North Capitol Avenue, and then there's the Binsfield Senate Office Building on 201 Townsend Street. Security does require folks to present a photo ID, and then legislative meetings will be from 1 to 5 p.m. So in probably later today, according to our schedules, later today you're going to get your scheduling and Advocacy Associates invite from Advocacy Associates. As I mentioned before, Advocacy Associates is our scheduling vendor, and they're doing the scheduling of meetings for us for this event. You'll receive an automated email from them. Please check your spam and junk folder if you haven't received it by the end of this week. And we'll send you a video with in-depth login instructions on how to access the Advocacy Associates portal, because that is where all of your meeting information will be. Once you're logged in, you'll be able to see your scheduled meetings. You can log in on the website or on the Advocacy Associates mobile app. I highly recommend using the mobile app because you'll be moving around in the Capitol, and when you're on the go, you can just quickly refer to things on your phone. But you'll get an email with all of the details about this. Once you're logged in, you'll be able to see all your scheduled meetings. And any meetings that say TBD, they're requested but still need to be locked down. At any given time, you'll be able to see what your current updated schedule is going to be. You can always click on the meeting in the app for more information. And you'll also be able to see who you're in the meeting with and the other attendees that are part of your group. But the Advocacy Associates app is sort of just the heart and soul of the actual Advocacy Day. Everything you need will be in there. So for our first legislative ask, we're going to go to Leslie Baldwin with the Michigan Rare Coalition. We're partnering with them for this event. It's an honor to. Leslie has been a rare disease champion in Michigan and elsewhere in the country for a really long time, and is going to provide us the education on the RDAC legislation. We'll be able to take questions at the end, and if you have questions about the event, there'll be time to take those questions at the end of the presentation. But for now, I'll pass it over to Leslie.
Terrific. Thank you, Syed. I really appreciate it. And we are definitely looking forward to meeting everyone next week in Lansing. I want to welcome you to the training today and thank you so much for your interest in the legislative process here in Michigan to benefit the rare disease community. We are a newly launched nonprofit representing the greater rare disease community in Michigan. We really want to help elevate the voices of every person affected by a rare disorder so that when we are looking at policies, the elected officials are listening to all of us, that they hear what the needs are and provide the support and look at the policies and how they're going to affect the community, whether it's going to be a positive or a negative effect. So what I'm going to be talking about today is the Rare Disease Advisory Council, known as the RDAC. This originally is an initiative of the National Organization of Rare Disorders, which is NORD. They help initiate the start of them, but this will be, I believe, will be around the 19th state that would have an RDAC if it passes, and I'm hoping. So this is a little shot of, I am not in this alone. I have a wonderful board that supports the work that we're doing. We have a comprehensive website with resources that are at the state level, federal, and for nonprofit information. We are really looking to serve the community to drive awareness, education, and advocacy. I became an advocate because I was diagnosed with a rare primary immune deficiency in 2009. And I was working in the medical center in Texas at Texas Children's Hospital. So it became hit really close to home. I'd worked with families and children for years, children with rare disorders specifically, and many of them had rare disorders. And I was just joining the group. Um, so as I moved through my journey, I started recognizing that other patients around me were having trouble navigating the system, weren't sure how to advocate on their own behalf, and I really wanted to do whatever I could to help. So I started volunteering, and that's how I hopped in here. Next slide. So our mission is kind of what I explained, but we're really looking at building coalitions within the community. And what I mean by that is we're looking at all stakeholders. At the heart of our mission are the families, patients, caregivers, families that are affected by a rare disorder. That is what we think about every time we're looking at making a decision as to what we are going to prioritize for ourselves as an organization so that we can support the community. Um, and then we look at stakeholders like elected officials, community leaders, hospitals, physicians, researchers, um, corporations, the pharma industry to try and build coalitions that really will help bring some solutions to some of the access issues that everyone in the rare community has faced at one time or another. Next slide. So, as you know, you've signed up for our Fall Advocacy Day. We are thrilled to be partnering with RDLA. As Syed said, they may not be here without us, but we would not be here without them. So they have been, if you are looking for advocacy training, they are the best. I've worked with a number of different organizations, and they really help provide the tools I needed to become an effective advocate. And I hope that you find the upcoming conference as valuable as I have attending to similar conferences in the past. Okay. So we're going to be talking about the RDAC Act here. It is Michigan House Bill 4169. It was introduced in the House, and it is currently in the House Health Policy Committee. It was sponsored and introduced by Representative Jason Morgan. He's a representative from Ann Arbor, and I'm really excited to say that he is going to stop down and speak to us while we are having our legislative morning session. So I wanted to talk a little bit about why do we want an RDAC? Why do we need one? So the RDAC really provides a way to help support the rare community. It offers the formal mechanism for input and recommendations that we can provide to them as members of the rare community. This would be including patients, families, providers, different advocacy and nonprofit groups. We really want to engage people at all levels, including Health and Human Services in Michigan. We all know, I'm sure everybody's aware about the proposed Medicaid cuts and what we really don't know what that's going to mean yet for the community, but we want to be able to raise any concerns that we might be having about the process. And this is going to be a way that we can help convey that by communicating with members of the RDAC. Okay, next slide. Okay, so what is the scope? The scope of the RDAC is to advise the Department of Health and Human Services and other state agencies on things that matter to those in the rare community, identify best practices, and develop public resources. As we all know, it can be really challenging to find the resources that we need readily. I know there have been many times I've been scouring the internet, trying to find the information I thought I needed and couldn't find it. So that is something that they will be working on with our website. I'm hoping it will be complementary to what they're doing. And not, we're not trying to reinvent the wheel, but we want to make sure that the information that community members need are easily accessible. We also want to increase awareness, and the RDAC advisory body can certainly help us do that. They will, we can look at future collaborations with them, and really, they are the ones that are going to be, you know, working on specific priorities that will then be presented to legislators to let them know what we are experiencing as a rare disease patient, caregiver, or family member. Okay. So this is one of my favorite little slides, and it just reminds me, and I look at when we're looking to move towards advocacy, what does that mean? It means we want to engage, learn, and then be able to advocate. But it's really hard to do that if you don't have the experience and tools in your toolbox. And so I look at it as this is the first step in building your toolbox. Many of you may have advocated before, some of you may not have. That's fine. There's really no background requirement, or, I don't want anybody to be nervous about it. We just have to remember elected officials are people. I think so. No, I'm just joking. I'll be in trouble. Yes, they are all people. And, I think we can all find things that we can relate to each other on. There are ways to do that. So I encourage when you get your packet from the Advocacy Associates that you just look at the background of the legislators you'll be meeting with, and I'm sure you'll be able to find something that you can relate to them on some level, even if they haven't supported the legislation that you've been interested in the past. You never know. You can always, the best we can do is really inform them and let them know what the stakes are. And I believe by working together, strategizing how we can move forward and the priorities that we want to address, we really will be stronger and we will be heard, rather than it's so difficult when you have a rare disease and you have a very small group of people. There are wonderful, wonderful advocacy groups out there. And what we hope to do is to kind of unite everybody. We have so much in common, so many common experiences, and our diseases, the things that are affect us may be different, but we all are experiencing access issues to some degree, the high cost of medications or healthcare, access to the treatments that we need or the diagnostics that we need. And so that will be part of this event, is helping you start through this conference to start building your toolbox. Next. This is just a graphic showing my wonderful co-founders and board members. They are all uniquely amazing people and members of the rare community. Kathy Lewis is with the Amyloidosis Foundation. Kayla Miller is with the Samara Foundation. Courtney Lee has a young son with a rare disorder. Laura Banal has two daughters with cystic fibrosis and has started, many of you may know her with the Banal Foundation. Chris Draper has experience in the biomedical field, specifically with rare diseases for the past 22 years. And Faith Squires is a very good friend I've known for, I hate to say, 50 years. So it's been a long time, but she is always volunteering and always willing to help, and an amazing advocate for anyone in need. Next slide. And here is our information. We have a QR code. If you want to access the website, you're welcome to contact us at any time if you have questions. We have our social media channels up. And we'd love to hear from you. We're always, welcome people that are interested in volunteering. And as we move forward, we look forward to working with many of you, and getting to know you better. And I hope that you will gain as much from this conference as I have from so many, and just the inspiration I've received from other patients like myself, family members, and caregivers. It's really been an amazing experience, and I look forward to meeting everyone next week. Thank
Um,
you.
Thank you, Leslie. We'll have a brief moment for Q&A at the very end. But for now, I'll pass it over to Marshall Smith from the Interstate Medical Licensure Compact, and he can tell us about this ask. Over to you, Marshall.
Thank you. Um, yeah, there you go. So, if you can go to the next slide. Just a quick overview of what the Interstate Medical Licensure Compact Commission does and how we have been very privileged to work with the rare disease community and this organization, and where we really appreciate the opportunity to be a part of this event that's taking place next week. And so thank you all for your hard work and for what you do, and the advocacy that you put out there, because it makes a difference, and it's incredible, and it's a beautiful, wonderful thing. So what the compact does is we actually expedite the licensure process for physicians. That's MDs and DOs. As most of you know, a physician has to be licensed in the state where they are providing care to a patient. So a physician can be in Colorado, if they're treating a patient in Michigan and the patient is located in Michigan, they have to be licensed in Michigan. We've created an expedited process that's a legal agreement between states that allows that process to take about 7 to 10 days. It's very efficient, it's very quick, it's very because the normal process for a physician to get a license through the traditional process takes about anywhere from 3 to 9 months to get a license. We're able to do that because our compact becomes a part of each state's um, it's a contract between all of the states, and they are then able to share data. Most of the time, when a physician gets licensed, they have to send all of their medical school transcripts, all of these transcripts to every state, and each state reviews them. Our process can do it quicker because the physician's already licensed somewhere, and that state organization already has all of those documents. So rather than each state getting its own set of documents, a state where those documents already resides verifies that the licensing information is true and correct. And so it can be done quickly. Where that's, yeah. So the next thing, so what happened is the compact was actually, Michigan is currently part of the compact and did join in 2019. It was House Bill 4066. It's a bipartisan bill. This is not, our process is not a partisan activity. It successfully was passed and signed into law. But what happened was they put, and I'm probably jumping ahead of myself, but that bill had a sunset provision. And for those of you that are aware of that, sorry to repeat information, but a sunset provision says that unless the bill is extended, or unless the law is extended, or the sunset provision is removed, that legislation ends. And so we were all set up. The sunset provision was March of 2025. We were set up working with the legislature. The bill was going to be, the sunset provision was going to be removed, and then the politics and the process happened in Michigan in March and April, and our bill never went through. And so Michigan is in the sunset provision process. That means in March of 2026, because our bill becomes it is no longer effective in March in 12 months. So we are in the wind down phase with Michigan right now. So the bill was passed in 2019. It was a bipartisan bill. It had overwhelming support in both the House and Senate. I put some information about the statistics of our bill, or number of licenses that were issued to physicians to practice in Michigan, our bill, or our process is able to provide access to physicians in rural and oftentimes underserved communities. And that's where especially people with diseases or illnesses or health concerns that are very rare, there are oftentimes very few specialists around the country that can address their medical needs and do that. By using by the compact, the state joining the compact, those physicians can get licensed in those states. And I'll give you an example in a minute of how that really does impact the life of the citizens of Michigan. And it makes their opportunity to get the health care they need happen. So there right now, if the bill that's before the legislature right now doesn't pass, 3,530 physicians will no longer be able to practice in Michigan. The licenses will be expired and they will not be allowed to practice in Michigan. 39% of the licenses that were issued to physicians in Michigan were through our process. And so it's a very significant has a significant impact on the number of physicians licensed and practicing in the state of Michigan. And the last thing, because sometimes money is a very important aspect of everything that we do, the state of Michigan was paid since they started in 2019. Physicians still have to pay their licensing fee, and the state of Michigan earned about $2.9 million since 2019. We pay them fees of about $20,000 a week that are paid by physicians and then are transferred to the state of Michigan as part of their licensure process. So the next slide, please. As I mentioned, so what happened is the sunset provision happened. We were working with the legislature and with a lot of people there. There was no opposition to taking on or removing the sunset provision. It just happened as a result of it just never got passed. It never got presented. The other part to it, and this is really the other aspect of the compact and the licensure process that we do, that is impactful for Michigan. If you are being treated by a physician in Michigan and you go to another state and you need care, let's say you decide to you love the Michigan winters, but you hate the summers, and so you go to another state in the summertime, and you live there for a period of time. Your physician can't treat you because they're not licensed in that state. Our process allows Michigan physicians to get licensed in those other states, and there are about 5,000 physicians in Michigan that have used our process to get licensed in other states to practice. So, let's go to the next slide, because I've got about 2 minutes left. So what I would like to do, or my ask of you, is that you advocate for the passage of Senate Bill 303. It was introduced in the Senate in May of this year. It passed out of the Senate with a vote of 36 yes and 1 no. So again, you can see both Democrats and Republicans. It's a bipartisan bill. So it passed out of the Senate. It was introduced in the House in May. Shortly after, I mean, it was basically introduced and passed out of the Senate in a week. It was introduced into the House. It passed out of the Health Policy Committee in June. It's now before the House Rules Committee. And hopefully it will pass out of the House. And so if you're advocating about this, speaking to your House representatives, asking them to ask that the bill be moved out of the Rules Committee and moved onto the floor for a vote. When it passed out of the Health Policy Committee, it passed with a recommend or a positive endorsement that it should be considered and should be voted upon. Next slide. So I'm not going to go into the next part. This is just for you to read. This talks about our process and how we are able to expedite the process and get safe, well qualified physicians practicing in states. So yeah, with that, I will turn it back over to you.
Thank you so much for your presentation, Marshall. Thank you for educating us about the Interstate Medical Licensure Compact. At this time, I'll take questions for both Marshall or Leslie. Feel free to come off mute and just shout them out since we've got kind of a smaller group. Okay, great. Seems like Marshall and Leslie did a great job.
I have a
If you do
question.
have any, oh, did I hear something?
I do. I have a question for Marshall.
Sure.
My son has a super, and I'm new at this. I've been advocating for my son's rare disease for 11 years, but I'm new to doing this in Michigan. But my son had an issue where we didn't have a doctor in Michigan that could treat his stomach issues, where he would vomit all day long and need to be suctioned and almost choke. And our insurance company continuously denied us to go out of state to get treatment and testing. And we still never ended up going. They kept saying it was experimental. So is this something that would have helped him where that doctor could have served him here in Michigan?
Yeah, and let me give you an example of that, and be sure to kiss your son on the head. That's a wonderful thing. Great story. So let me give you an example of how we've been able to do just what you're talking about in getting the physician's license. We don't deal with insurance, but we get physicians licensed. They receive a full and unrestricted license to practice in your state, just as if they would have gone through the traditional process. MD Anderson, which is a cancer center in Houston, Texas, uses the compact to expand the number of patients that they can see because they get their doctors licensed in the state where their patients are residing. The patient, oftentimes with limited mobility, which before they couldn't go and get treatment in MD Anderson because they couldn't travel there as often as they needed to. So what MD Anderson does, and a lot of hospitals, the Mayo Clinic is doing this, um, uh, John Hopkins is doing this. They get the patient goes to their local practitioner's office. The physician at MD Anderson joins that visit remotely because they're licensed to practice in that state. The patient is there with their provider and the physician from MD Anderson. They do their pre-evaluation, their post-evaluation, and the only time the patient has to travel is to actually get their treatment uh, in Houston, Texas. So they are getting the care they need with their local provider whom they trust and they've established a relationship in their state. So I think that's something that could very well happen for you and what you're saying, because that physician in that other state can get licensed to practice in Michigan.
Thank you for that answer, Marshall. We have time for maybe one more question, and then we got to go on to the next phase of the presentation. I see a hand up, Kirsten or Kristen.
Yeah. I am a physician and rare disorder patient, and I'm wondering how many, I know there's this sunset issue has been an issue in other states as well. Can you explain how many other states are currently have the IMLCC active, please?
Yes, we have 42 states, the District of Columbia, and the Territory of Guam. All of the states surrounding Michigan are part of the compact. The ones that are not are Alaska, Oregon, California, New Mexico, South Carolina, Virginia, and New York and Massachusetts. There are 10 states that are not part of our compact. And it's all on our map if you go to our webpage, imlcc.com.
Thank
Excellent.
you.
Thank
Syed,
you so
could I mention one thing before we switch into our groups?
Absolutely.
So sorry to interrupt here. I should have mentioned, but I just wanted to be sure that everybody knows the day of the conference, we will have one-pagers on the different pieces of legislation. I will also, I know for ours, I'm going to be putting together a kind of cheat sheet for everyone with talking points. So when you go and if you're doing legislative meetings, you will have those materials with you, because I know some of the stuff, it doesn't flow off the tongue very easily sometimes, and it's hard to keep it all straight. So I kind of wanted to just throw that out there for anybody who hasn't done this before, to not panic. Like, this is, a first step, but that we will have materials there that'll help support if you have an ask that you want to share while you're during your meetings. Go ahead.
Absolutely. Great call out, Leslie. And we're going to talk about that in just a little bit before we go into our breakouts. But that's a great transition, honestly, into the next segment. Before we go into that, though, we do have a third ask, but the training for that is not today. It will be the morning of the legislative conference. It will be about Senate Bill 434, which is sponsored by Senator John Cherry, and has been referred to the Senate Health Policy Committee. It's supported by the Epilepsy Foundation of Michigan, and we'll be using some of their materials in our presentations with legislators. Senator Cherry's staff, including the person who wrote the bill, will be present at the conference to help us get educated on it. And more information about this legislation will be included in your event packet and in your Advocacy Associates portal. Did the Q&A. Let's talk about how to actually do these meetings and what they'll be like. So before we get straight into what those meetings are like, if there's other stuff you'd like to talk about that has not been covered in this presentation or won't be part of our asks, Every Life does encourage folks to feel comfortable discussing that. You're having FaceTime with your legislator. All of your concerns are worth mentioning. Our requirement, though, is that if you do have something else you'd like to talk about, please bring a one-pager and make a one-pager on that. We have information on how to make one-pagers. If you have questions about how to make a one-page document about your issue, feel free to reach out to me, and I'm happy to help you put one together. But a one-page document is our requirement for anyone who wants to talk about anything that is off topic for the event. What does an in-person meeting with the legislator look like? So you'll be joined by your Senate or representative or a staff person. You'll have short introductions, maybe about 2 minutes, because the meeting is going to be 30 minutes long. Share a 2-minute story about who you are and your connection to rare disease, and then connect your story to the legislative ask. If you can find a way to relate your story to the rare disease community, to how this legislation will help you or help someone you know, that is perfect. That is what we're looking for out of these meetings. Leave time for the legislator staffer to ask questions and learn more about what they're working on and more about the concerns that you have. I always recommend kind of wrapping up the storytelling portion of the meeting with about 10 to 15 minutes left, because that's usually enough space to get your questions for the legislator or the staffer to ask questions and get to know you a bit more. And then if the meeting goes really well, feel free to thank them for their time and take a photo. Since y'all will be in groups and you will be meeting with your groups ahead of the legislative meetings at the conference, I highly recommend folks during our legislative conference, during the breakout session at the end of that conference, decide maybe a group leader or figure out a speaking order so folks aren't saying the same stuff. But that is just the general flow of how a meeting with the legislator or staff will look like. By the way, about half of our meetings that we've actually confirmed with the legislator. So they'll be there. Many of you will get to meet your member. What to do before the meeting to optimize for success. I would recommend learning about legislators. Check out their website, check out their press releases, check out their newsletters. You'll know through the Advocacy Associates app exactly who you're meeting with. So check out their public-facing materials. Learn about the bills that you want to discuss and know the bill numbers. In our packet, we'll have all the bill information for all 3 bills that we're advocating for at this event. And then, as I mentioned, coordinate with your team to determine who will make the ask and what the speaking order will be. And then practice. Practice your 2-minute story between now and the legislative conference, so it does roll off the tongue. And practice your ask and making the ask. What to do during the meeting to be successful. I would recommend arrive early. Be pleasant and respectful to the legislator staff. In Michigan, they will have like a front office person. Feel free to chat them up. Usually it's some young person wanting to get ahead in politics and start their career. They can be really fun folks to talk to. Thank the legislator if they've supported rare disease legislation in the past. I might actually make a cheat sheet on some of the bills that have already like halfway through the process, so you know if the person that you're meeting with has signed off on the bill already or not. But yes, if they're someone who's supported rare disease issues in the past, feel free to give them a thank you. And then avoid talking politics. And what I mean by this is talking about the red and blue of the day and talking about things through those lenses. Rare disease issues are nonpartisan. As actually Marshall showed through the IMLC, you know, that bill passed one of the chambers with almost unanimous vote. And rare disease issues certainly deserve champions on both sides of the aisle. So don't approach it from a partisanship mindset. I would recommend just talking to them like there's someone who can possibly help out and get this bill passed. Answering tough questions. Folks are often intimidated by not being able to answer a question, but what I like to tell our attendees is that not knowing the answer is actually one of the best things that can happen to you in a meeting because it lets you say the magic words, I don't know, let me see if I can find the answer to that question and get back to you. And what that does is it keeps the conversation going past just the 30-minute meeting time you've got with them. Now you've got a dialogue with them that can continue in your inbox, and you can use that to maybe even set up a follow-up meeting later after the event. And you can stay engaged with that person. So if I don't know the answer to a question, that is an opportunity to turn that into a relationship building point with that office. If the legislator is not supportive of your ask, the most diplomatic line that we can come up with here is, I'm sorry we don't feel the same way. Hopefully there's something we can work together on in the future. Because then you can keep the door open for maybe future rare disease issues or other bills where they could be a yes vote. What to do after the meeting. Send a thank you note to the legislator and staffer. Feel free to post on social media and tag us. We're at Rare Advocates on all socials. And then follow up by email. If they asked a question, feel free to provide them an answer. And then sending them a digital version of the one-pagers is also a good idea. We'll make sure you all have that as well. If you need help answering any questions in between your meeting and like your follow-up email and you just can't find an answer, feel free to reach out and our policy folks can help. When it comes to making your ask, remember you're in the driver's seat. They're meeting with you to hear what you have to say. Balance fact and emotion. And what I mean by that is there are very valuable statistics that can go alongside your personal story. So feel free to use both. And less is more. Staffers are uniquely interested, I'd say, in meetings that are brief because they really want to get to the point and they meet with a lot of people and it's hard for them to remember everything. So if you really just show the key points, that's what they can take with them. And then a very quick and easy structure for how you can present is talk about the problem, solution, and then make the ask. So for example, with the Interstate Medical Licensure Compact Bill, SB 303, you could say something like, many rare disease patients do not have access to the necessary medical care in their area. And then you can say the solution is this bill, which provides a streamlined process and an expedited pathway to licensure for qualified physicians. And in turn, it increases access to medical services. And then you can go right into the ask, which is please support this bill. Please support SB 303. With all of that being said, and I know I rushed through a lot of that, I will send all of this information to you all in a big email at the end of the week. We're now going to do breakout rooms. I really wish I had elevator music for this segment because I need to take 1 minute to actually break everyone out in a room. So please hang tight. And soon you'll be teleported into a small breakout room with a member of RDLA staff, and you can practice telling your story. We don't have a lot of time. I'm going to try to run it for 10 minutes, but then I'll pull everybody back. So give me 1 minute and we'll get that started.
Okay, thank you.
Okay, welcome back, everybody. I'm so sorry if I didn't give you enough time to share your story, but we'll have another Share Your Story breakout session in person at the legislative conference. In this last minute, I'm going to leave you with 3 final reminders. 1, you'll get a big email from us towards the end of the week with all the information you need, including a recording of this webinar. 2, between now and the end of the week, folks will start getting their schedules from Advocacy Associates. Feel free to reference both this webinar and the information in that email to get logged in and see who you're meeting with. And then 3, if you have any questions at all, I will be glued to my phone between now and the event. So please reach out at sejaws@everylifefoundation.org, and I'm happy to answer any questions you have about the event, your registration, getting there, logistics, the asks, anything. So yes, I will leave you with that, and thank you all so much for hanging out with us today. We'll see you at the event on the 30th.
Thank you, everybody.
Bye, y'all.
Thank you.
Thank you.
I look forward to seeing everyone. Have a good week.
You too.